Smash. Keep smashing.
You know, no matter how difficult life can get, there's always lipstick.
Snoni madiche nwa fasi. Chifufa makoleni mara madiche nwa fasi. Snoni madiche nwa fasi.
I tip my crown to the queen in me. This is who I'm meant to be. Beautiful, powerful, and stronger than I've ever known. Bow down to the queen in me. It's my time to take the lead. It's beautiful and powerful. Bow down to the queen in me. Bow down to the queen. That song always makes me feel so great. Today on the Liberty Report, I want us to talk about something very important, and that is taking full control of our sexual health. Coming up on the Liberty Report. With over 20 million cases confirmed globally of coronavirus, there is no doubt that this virus has had a huge impact in terms of how we live our lives. Take, for example, our ability to travel and move around. According to an article written in The Conversation by Nezri Pediaki and Kochi Naidu, there has been a disruption as far as the dispensation of HIV medication. In fact, the Gauteng Department of Health is reported to have had a drop in medication collection of HIV meds and treatment of 19.6%. About 20% of people who are HIV positive in Gauteng have not been able to collect their medication from clinics and hospitals since the lockdown. And although the government has introduced the multi-month approach where you can collect multiple medication for many months ahead of time, we worry that the implications of this decision coming now might be a bit too late, because according to a modeling study done by the World Health Organization, a 6-month disruption in the dispensation of HIV medication could result in at least 500,000 deaths in sub-Saharan Africa between this year and next year alone. I mean, 500,000 deaths as a result of 6 months of disrupting HIV medication results in 500,000 deaths. And remember those rumors about digging out 1 million graves? All I'm saying is just think about it. Think about it. Think about it. If travel is affected, many other industries are subsequently going to be affected. In South Africa, that's a very unfortunate reality because travel and tourism is a big contributor to our GDP. Other aspects of our lives that have been affected by the coronavirus include mental health. Our ability to not be part of communities like we used to and seeing our family and friends as easily as we used to has meant that many people who have mental health problems have now sunk into a dark place. And that is something I feel like we are not talking about enough. And it's going to be even more scary when we think of the joblessness that's taking place in the world and how people are losing their jobs everywhere as a result of companies not being able to cope under the economic pressure that the coronavirus has brought in our lives. The most unfortunate consequence, I think, of the coronavirus is how access to treatment for other diseases has been affected. In addition to the burden caused by coronavirus on our public healthcare system and in our lives, think about queer people who've already had to have challenges of fighting stereotypes when accessing healthcare treatment. Who is telling those stories about my people? Who is documenting all this injustice that is happening to our community? That said though, I do want to give a big shout out to organizations like Engage and Health for Men and other organizations that are working with the queer community to make sure that we have access to HIV prevention and treatment as well as other services. The reason I built the wall behind me was because as a freelance journalist writing about queer issues, I wasn't feeling heard. As a queer person, I didn't feel represented, and I still don't feel represented by our news cycle. So I decided to build a wall of representation and liberty behind me to remind myself of who I am, of what I can be, and what my people are capable of, because no one is writing about us in ways that are dignifying. And if anything, we are seeing that people are building walls to exclude people and not include people. So I built a wall to make sure people are represented and included, and on my wall you can rely on one thing, and that is you can lean on my wall for support, because walls are supposed to include people in and close people in and provide them support to lean on in difficult times. So hit the subscribe button to lean on my wall for support and inclusion and representation for queer people. That even further, I decided to push the envelope with myself, because one must push the envelope. One must push the envelope with oneself, and one must push the envelope with one's craft. So I decided to push the envelope with my journalism and tell our stories from the garage in a new segment on the wall, which is called Lifting the Veil. The Veil is garage journalism, and that is telling our stories from our own garages. If the big institutions and big corporates will not hear us, we will do it ourselves, and we will do it in our garages. I decided for the very first Lifting the Veil to invite Engaged Men's Health to talk about how we as a community can have better access to HIV prevention and treatment. Take a look.
How I became to start being involved in this health field. It was in 2008 where I was exposed to sexual violence, and bad enough such services weren't available then. I went through a very terrible time having to access services from the police station before, and moving forward to the health facility, where else amongst your journey there was so much discrimination and stigma because I was different from everyone else. You know, gender equality. I never got the help that I really needed then, which made me realize, Guti, I'm not the only one. There's a whole lot of people like me. A friend approached me and said they had a program called an EPOA that was going on, and what happened was that they needed me to access the services, because as a trans woman I really don't feel comfortable being in a general clinic. I would rather be in a place where I feel more comfortable and accepted and not discriminated. So yeah, I gave it a shot and it worked out. Where I got to invite my friends, and then Engaged Health Women came over. Everybody accessed the services.
If you call Engaged Men's Health to come to your home for an HIV test and it turns out that you're HIV negative, that does not mean you now get to sit back, relax, and do nothing about your sexual health. What you should do instead, which is what I've also just started doing, is take PrEP.
If you're negative, we offer PrEP. Okay, which stands
exposed,
yeah.
There is PEP.
There is PEP. So PrEP stands for pre-exposure prophylaxis. So pre means before you have been exposed. So let's
So
say...
this is a prevention tablet.
Yeah, it's more of like a prevention tablet. So this prevents you from getting the HIV virus. So what happens is, yes, we need to test you because we do not want to put you in a medication without knowing exactly what's happening in your body. So we do test you, and we do ask the questions. Have you been exposed within, the last month or not? If you're like, oh yes, I have, then we have to put you onto a window period. Then from the window period, we retest you again. And if you're HIV negative, that's when you give you PrEP. It's a daily pill that you have to take every single day, because anything that goes into our body as a pill, depending, because antibiotics has its own time, depending on the medication, but most of the medication is a 24-hour circle. So when we say 24-hour circle, if you decide that you want to take your medication in the morning at 8 o'clock, shall it be 8 o'clock every single day in the morning? I've been on PrEP for the past 4 years. Never have I ever had a side effects. Never. Some people get side effects, others don't. What we normally say is, shall you experience these symptoms for 7 days? Because you actually have to take the medication for 7 days accurately, like without being exposed, so that it gets used to your body. So, but within that, shall you get the symptoms for more than 7 days, like it passes 7 days, then we ask you to kindly contact us. But we do also follow up with you. So we then ask you to come over to the clinic, or we come over to you just to identify and see what's going on. Like we'll take bloods, we'll take it to the lab, and maybe your kidneys are failing, because that's actually one of the biggest things that we look at when we initiate you onto PrEP. We take your blood to check your creatinines, which is your kidneys, and to also check STIs as well.
Take PrEP because it really is the best case scenario for prevention being better than cure. Let's talk about what happens when you call Engage Men's Health and they come to your house, do an HIV test, and it turns out that you're HIV positive. What are your options then?
We are out here. That's why we're out there in the community saying we understand the stigma and discrimination around. We understand that people are not going to want to easily just go into service. So how about you bring your network into service, just so that they can access the service and see that we're actually very different. We are here for the LGBTQ.
Now I'll tell you, there are a whole lot of different organizations which offer different services to different type of K-pops. Engage is one of the best organizations that's around, that's also providing their services to the key population. We are here. Just go on to Google, use your internet, search for information. Though everybody is not able to access internet, that is why we always out there to the field to say we're here for you guys. Especially with the EPOA program that she has mentioned.
I was actually about to add.
It's one of the best ways of reaching out to the community. How you treated in your general clinic, it's you're not treated like everyone else. You're so different from everyone else, to a point where you are aware that you stand out from everyone else, but then when someone enforces that on you, then it makes it very difficult for me to be even comfortable to wake up the next morning knowing I've got something that's bothering me and I'm unable to talk to a nurse who is not sensitized about the LGBTQI community, and feeling discriminated while I am out there to get help, and it just destroys you as a person. So you wanna be in a place where you're able to talk about whatever issues or challenges that you're facing as a person, let alone not anyone without discriminating or pointing a finger at you.
I'm about to overshare, okay? Because a few years ago, I remember I had gone to a party and I had so much to drink. And I remember waking up and someone was on me, on top of me, having sex with me. And I had just I was waking up from that fact, and what I remember is that there was no condom involved. And for the longest time, I blamed myself or judged myself for being that drunk at the party. And I thought, I probably did want to have sex with that person and was so drunk that I ended up in their bed drunk. But, I've since come to know that nothing justifies someone having penetrative sex with you, having sex with you, touching you when you're unconscious, which is exactly what I was. So I recognize the sexual violence that moment was. But I remember how worried I was afterwards because I had been exposed by having sex with this person without my consent and without a condom. And I remember running around trying to understand what my options were. And at the time, Engage Men's Health wasn't established yet, so I went to a Health for Men clinic in Yeoville. And before I even learned about Health for Men in Yeoville, I had looked up on the internet and I found out about this wonderful option called PEP, post-exposure prophylaxis, and I was like, oh my gosh, I need to get hold of that within the next 72 hours. And I was a student at the time, so I soon discovered that it was expensive. When I went to a pharmacy, I think at the time it was like 600 Rand. And I was like, oh my gosh, I don't have that kind of money. What am I gonna do? And thank God I found out about Health for Men and the kind of work that they're doing at the time, because my friend took me there, said, let's go to this place and I'll be there. You'll have to do an HIV test. And I went there, did an HIV test, and the doctor put me on PEP. And it meant so much to me to know that option was available for us, for me, even though the clinics were busy asking me about case numbers, because you must be a rape victim and you must present a case number in order to get PEP, but not in these organizations that are geared specifically towards helping queer people.
For me, that's an emergency. It's a complete emergency. Let's work on this now, because you only have 72 hours, which is like 3 days, to get yourself to our facility or contact us when you have been exposed. So with us, it's actually more, it's different, right? We don't thoroughly investigate like what actually happened to you. Just your cry for help is enough. It's completely enough for me. I don't have to be like, oh, well, you're a rape victim, oh, what happened, blah, blah, blah. No, you have been exposed and you are within 72 hours, because after 72 hours, literally, there's nothing we can do. So it's like within 3 days. Somebody says to me, this is it. I'll be like, are you able to get yourself to the clinic? Where are you? Like, remember, we have teams working all around the 7 regions. Where are you? Oh, I'm in Soweto. I'll definitely call my team in Soweto. There is somebody that really, really needs help. Are you able to get to this person? Here's the contact. Like, I'll literally ask you for your contacts, your location and everything else, so that they are able to get to you. Because it's not just only about, oh, you're HIV positive, go into treatment. It's also about, you're HIV negative, go into PrEP to prevent yourself from getting the HIV virus. You've been exposed, go into PEP.
I may be openly out, somebody else might not be, and might not be comfortable to even letting their neighbors know. So the social network strategy, it's one of the most snowballing way of getting the hard to reach, the ones that really need to access the services but do not know where to start or know how to. So if she is able to get hold of me as a seed, I'm able to plant the 2 or 3 people, friends I know who are afraid to go out to the public.
What's the anxiety around people not wanting to know their status?
It's the fear of knowing the truth, fear of what is she gonna say if she knows?
It's important for you to know about your HIV status and know that there's something that you can do about it. Okay.
Spread the word. Share this video with your friend. Tell your friends about Engage Men's Health and other organizations, but make sure you do your part to get word out there to LGBTI people to remind them that they can get access to HIV prevention and treatment and that they don't have to sit quietly in the corners of shame. They can come out in the sun, plug into existing networks and find out what organizations are available in your community that are aimed at helping. Speaking of spreading the word, I reached out to makeup artist, activist, and TV presenter Muzi Zuma, as well as musician Shade Worldwide, to offer an encouraging message of hope to all the lovers of liberty out there on taking full control of one's sexual health. Take a look.
I think we're currently living in very unfamiliar and very uncertain times, but the one thing that advancements in the medical field have allowed us to do is that when it comes to issues like HIV and AIDS, we no longer need to be unfamiliar and uncertain. We now can live a healthy life irrespective of what our status is. And this moment is just for me to encourage you to go out there and get to know your status, because in that way you're able to take all the power that you need. For me, I've been on this PrEP journey for the past 2 years, and it's brought back just so much zest, so much zeal, and so much oomph just to go out there and live, just because I know that I have got my status covered. Please go out there and get tested. By getting tested, you allow yourself to receive counseling that can put your mental health at ease and also encourage you to really go out there and conquer life. But it can also give you results that can direct you either via PrEP or the route of ARV, which is important because again, that is going to allow you to live a longer and more fulfilled life.
Getting tested for HIV affords you the opportunity to save your life, in a sense that should you test positive, you will be recommended to start with the treatment, which obviously will improve the overall quality of your life. Testing for HIV is not just an act of self-care, but it also means you get to protect those you have sexual interactions with. Over and above those ones, it means you care about your family, you care about your friends, you care about all those that are close to you because they wouldn't want to lose you. Also, it's quite great that healthcare services have become so accessible for so many people. I, for example, as a gay man who might feel some type of way about going into a general clinic or hospital to get tested, there are facilities such as the Engage Men's Health Clinic, which was set up to cater for the needs of homosexual males, bisexual males, and guys who have sex with other guys. So it's a space that's comfortable where they understand where you're coming from.
Go out there and flourish by taking full responsibility for your health. Put the power in your flower by taking full responsibility of your HIV status. Okay? Because knowing is half the battle, and now you know. Proto Freak is taking place, and it's taking place this week from the 14th to the 16th of August.
Pride is taking off in Africa.
Hi, Pride Afrique.
We are having Pride Afrique later this year.
Pride Afrique, reclaiming parts of the queer African history.
Pride Afrique, to celebrate our Afro-queerness with you.
You are not alone.
Joyeuse Pride Afrique.
We're gonna be great. It's gonna get better.
Happy Pride, everybody.
Happy Pride means my right to exist.
Use my voice to show people that there is hope. There is always hope.
Happy Pride Afrique.
We have always been here, and we cannot be erased.
Make sure to visit prideofreak.org for more information on the lineup and on how you can participate in the 3 days of amazing Afro-queer storytelling like never before.
That cute catty thing.
Yes. Because you're trying to be catty, ain't you?
Meow. Ooh, it's like the beard a bit. I want to clean it up. Wait. I got you. Woo! Come through.
Coming up next on the Liberty Report, I sit down with the mother of the House of Diamonds, Treyvone Moo, to talk about their appointment as chief editor at Exit. We also spoke about the ball scene and queer representation. Plus, we also have a big announcement to make about Pride of Freak, right here, coming up next on the Liberty Report.
Thank you for coming on the wall. Oh my god.
Thank you for having me.
It's so good to see you. It's not the Liberty Report until there's lipstick,
Yes,
right?
apparently. It's customary. I've been baking a cake a week. It's very bad, but
No, that's a good thing. Oh my god, baking a cake a week and they want to complain about that?
there's been no alcohol, girl needs a cake.
The girl needs cake, right? And if a girl can make cake, why shouldn't a girl have cake?
Because no one wants to eat
I treated myself. No, no, How's this time been for you? This lockdown period?
A roller coaster. It's been a roller coaster. I think I've struggled a lot, but I've also learned a lot. I've evolved. I really have. I mean, recently I actually demanded my friends start using the term they when they address me. I feel like I've gone through an array of emotions. Places that I didn't even think I'd ever get to. But holding on to that.
Treyvone is taking on Exit,
yes,
as the editor-in-chief,
yes,
at the moment, and you are doing such a fantastic job from the first issue.
Only been a month,
and it's only been a month, and I mean it has such a historic kind of value because it's one of the oldest newspapers in the country.
It was started in the 1980s at a time deep in apartheid. If we think about 1980 and what's happening in 1980, we've just had the 4 years of the Soweto March, the anniversary of the 1976 4 years. We are deeply entrenched in apartheid. At that point, the last editor, Gavin Howard, he at that time felt the need to start a paper that could reflect
at that time.
There's importance in having a reflection of your existence. It's why we want to see each other. It's why gay people want to hang out with gay people, lesbians want to hang out with lesbians. It's because you want to have a mirror.
Your lived experience reflected as a reality somewhere in the world.
Absolutely. You just said that looking at this makes you feel connected to yourself. It's a reflection.
That there's something tangible out there. Yeah, that reflects me.
So
and that's powerful.
Yeah, that's powerful. That is powerful.
Well, it has been predominantly a white paper.
I would say that you almost had 60 or 70% white gay agenda, and then you had 10% drag queen representation, Soweto black drag queen representation. But what was lacking for me, and why all of us know about it, but I don't think that there are many of us that identify with it, or that it's not a thought leader after 36 years of existence. It sometimes felt a little resistant to evolution and change.
You have been such a important and influential voice in the queer community with the ball scene. For example, the very first time I dressed up in full dress was at the La Grande Ball for the African royalty.
Yes, Mom.
Tell me about how you came up with that and how that became a thing, as amongst the many other things that you.
I've always been passionate about being gayer than gay. Like, girl, you know me.
Yeah, this is not like
it's not a performance.
Yeah, it's not a performance.
This is who I
don't think people understand.
No, it's really who I believe in being unapologetic about your existence, being loud and proud about your existence. I also don't think that there is anything that is remotely overly personal that I can go through that no one else has gone through. So I also believe in the power of being vulnerable and sharing experiences, because that creates a reflection for somebody else. I really storytelling for me is super important.
I love that. And how did you weave? Yeah, so like how did you weave like the ball? How did you come to the ball from creating space for vulnerability and embracing oneself?
It was through the experience and through the testimony that people would give after a ball. If you took,
but the very first ball.
No, let's take one of the most iconic balls. The fetish ball.
Oh yes.
One of the most iconic balls.
The fetish ball was
iconic.
The fetish ball.
Listen, there was a battle. It was something else. It was something else.
It was something else.
When I witnessed and this is the special thing about tennis club and ballroom as on that space, is that when I witnessed sort of an abandoning, a rebellion, an abandoning of conformity, a rebellion of what is normal and hidden and order, and there's this beautiful chaos that there must be space in the world for that. We have to create spaces that are where people are able to be unapologetic and free.
And especially like queer people, right?
Must be able to live their truth.
With that kind of understanding of you coming into the ball scene, now we are talking about the Pan-African ball after party that's coming up for Pride of Freak.
Let's talk about Pride of Freak for 2 seconds.
Yeah, let's talk about Pride of Freak.
Let's talk about 2 seconds.
The power that has, the intelligence that has, the clearance that has, the access that has, the influence that has, the profile that has, the international implications that has.
So we're going to be giving you a daily wrap-up of Pride of Freak for the 3 days that is happening from the 14th to the 16th of August.
Listen,
we are so excited!
I don't think we get enough stories out of Africa. So I'm really excited to hear first-hand accounts of both hardships and the celebration.
The celebration. Subscribe button.
Wrap up is going to be here every day on Friday, Saturday, and Sunday, and then on Sunday evening, right after the wrap up.
Yes, after the wrap up, do you want to tell us what's happening?
We're going to be having the Afro Kiki Ball.
The Afro Kiki Ball.
Yes, and listen, we actually have money to give anybody on the continent. We are working on a dollar system, and we'll be paying money through either a Western Union or whatever, you know.
So tell them how many dollars you get.
Honey. I think we're gonna need to follow at the Grand Ball.
I'm already putting my hand up. Okay, I'm gonna be signing up to get a few dollars.
I know it's tough out there. It's a lot of dollars, and all you need to do is be cute for 1 minute in front of your phone.
1 minute. 1 minute. 1 minute. I mean, already we've been cute the whole time. So.
take responsibility for your life.
We spoke about awareness, and whether it's in a garage, it's in my car, I don't know, as long as I can put the word across. That's what it is about. But your garage is lovely. It's me being kind.
Thank you so much for tuning into the Liberty Report. Remember to share this video with a friend. It could save a life. Thank you for watching. You know, no matter how difficult life can get, there's always lipstick.
Chipupa magolini mara